Hello and welcome to Speaking of Health, a place where you can learn how to live a longer and healthier life. I'm your host, Jason Howland, and our topic today is paying attention to ADHD. And joining us is Dr. Janis Strickler. She's a board-certified child, adolescent, and adult psychiatrist at Fairmont Medical Center, part of the Mayo Health System. Thank you for joining us today, Dr. Strickler.
Thank you for having me.
Well, before we get into the heart of today's topic of ADHD, let's talk a little bit about mental illness and mental disorders in the medical field of psychiatry. First off, what's the difference between a psychiatrist and a psychologist or therapist?
Well, there are similarities and differences. Both psychiatrists and psychologists work in mental health clinics. Both of them can do evaluations when people come in with different problems. Both of them can make diagnoses and discuss treatment plans. The difference, the psychiatrist has gone to medical school and is an MD, doctor of medicine, and can prescribe medications, if medications would be helpful. The psychologist cannot prescribe medications. The psychologist has gone to a different school, the medical school, usually graduate school, and can provide psychological testing.
Well, let's talk about mental illness. So often it seems like there's a stigma involved when we're talking about mental illness and mental disorders. But millions of Americans actually suffer from some form of mental illness, right?
Yes, very much that's true. The difference between temporary psychological symptoms and a mental illness, which is actually now called mental disorder, is pretty much the intensity of the symptoms and how long they last. So people who have temporary symptoms, especially if they're mild, usually those will go away on their own and they don't need the services of a mental health professional. People who have symptoms that persist and are making them suffer or are making it hard to function at school, at work, in their relationships, that suggests that there's a mental disorder that's developed, and those people would benefit from having an evaluation.
What are some common mental disorders that you help patients with?
Well, the most common mental disorders in the world are anxiety disorders, and there's several different types of anxiety disorders: generalized anxiety, social anxiety, separation anxiety, obsessive-compulsive disorder, post-traumatic stress disorder. So those are all anxiety disorders. And then mood disorders are the other most common ones. And there's depression and also bipolar disorder. And then, of course, there's ADHD, which is another disorder that can happen, and many more.
Well, today we are talking about ADHD and paying attention to that. And first of all, what exactly is ADHD? I've heard of ADD. Is it the same thing?
Well, ADD is the old name for ADHD. ADHD is the new name. They're the same disorder. In the past, it was also called hyperactivity. And basically, it's a set of three different types of problems. And people can have different numbers of these problems. So some people will have all three different types of problems, and their ADHD will look quite different than the person who just has one of the sets of problems. The one type is attention regulation problem. And this is not an across-the-board problem paying attention, which most people think it is. This is a problem with regulating attention. So people with ADHD will over-focus on things that are interesting to them, and then no matter how hard they try, will under-focus on things that are not interesting to them. And even when they're trying to pay attention, they'll get easily distracted or they'll forget what they're doing. It'll be very difficult to finish tasks where there are these attention problems present. So that's the attention regulation part of it. Hyperactivity symptoms is the second group of symptoms, and that's really what it says. It's hyperactivity is lots of activity, lots of energy, wanting to be doing something all the time, impatience, restlessness, hard time sitting still. That's hyperactivity. Then the third set is impulse control problem. And an impulse is an urge to say or do something, and people without ADHD will have an urge and then stop and think about it. You know, is this the right time? Is this going to break rules? Is this going to get me into trouble? And then decide if they want to act on it or not. People with ADHD get the urge and act, and then think about it later.
Can someone have all three?
Yes. In fact, boys usually have all three, and they typically are noisy and moving around a lot and are disruptive, and it's quite obvious to people that they're hyperactive. Girls typically, though they can have all three, girls typically have more of the attention regulation type alone. And these are kids, they don't cause trouble in school, but they'll basically daydream and not work up to their academic potential, and often never get diagnosed.
When do the symptoms start? And is it primarily in children, or is it also in adults?
Well, the thinking on this may change with time, but the traditional thinking has been that by definition, the symptoms have to have started before age 7. The current thinking is that perhaps that's not true for everybody, that sometimes it can develop later than that. It has to happen in more than just one setting. So if these symptoms happen only in school and no place else, that's not ADHD. It has to happen at least in 2 different settings, such as home and school, or school and in social relationships, that sort of thing. They have to last more than 6 months. So kids can temporarily have kind of look-alike ADHD symptoms if they're stressed, but those will typically go away. If these go on for 6 months or longer, and usually it's for many, many years, then it's much more likely to be ADHD.
So an adult can't all of a sudden suddenly have ADHD. This is something that would have occurred starting in childhood, right?
Typically, for the most part, yes.
Well, a lot of the symptoms you talk about, it just seems like the way healthy kids act sometimes. They're inattentive, restless, impulsive.
Well, it's a matter of how much it's occurring over time and how severe the symptoms are. So if a child has very mild symptoms that are not interfering with how they're functioning at school or interfering with their social relationships, then that's not ADHD. So it has to be sufficient duration, greater than 6 months, and then it has to be causing trouble.
What causes ADHD? I would imagine a lot of parents may feel guilty, like it's their fault, but it's not their fault.
It is not their fault, and nobody really knows for sure what causes ADHD. It's felt that there's a strong inherited component, and it does very much run in families. But there are many families where the parents won't have ADHD and the kids will. And so, that's not a definite one-on-one correlation. Studies are now showing that the brains of people with ADHD develop at different rates, and also different parts of the brain are active compared to brains of people who don't have ADHD. So there may be a structural, functional difference in the brain. If there's been what's called a gestational stress, so if the moms have had a stress during the pregnancy, such as if the child is born prematurely, or if she's been exposed to certain toxins, or if she smokes or uses drugs or alcohol, then there's a higher chance of ADHD developing. But not necessarily either, just a higher chance.
So as a parent, I suspect that perhaps my child may have ADHD or is showing those symptoms. I bring my child in to see you. What exactly happens?
Well, there would need to be an evaluation. Mm-hmm. Much of the evaluation consists of many, 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 many questions that are asked of the parent and also of the child. Some of these questions are, when did you first notice problems with your child? What's developed over the years? What are the current difficulties? How are these problems causing difficulties in school or at home or in the friendships? What have you tried that works? What have you tried that doesn't work? How is the child sleeping? How is the child eating? Is there a family history of psychiatric problems? And many, many, many more. But those are some of the important ones. There would also be a recommendation that if there's not been a physical exam within at least a year, if not sooner than that the child have a physical exam to rule out any physical problems that can cause ADHD-like symptoms, but it's not ADHD, it's a physical problem instead. And then there would need to be collaboration with the school to get some information about how the teachers think things are going at school. And there's a number of ways that information could be obtained. Then there would be what's called a mental status exam, where the child would be evaluated, or adult, if it's an adult who's coming in with these symptoms, and get a sense of how the person handles social interactions, how they think about things, basically get a sense of if they're depressed or not, if there are other things that may be going on that could be contributing to the problem. Then if it's looking very much like it is ADHD, there will be a discussion about ADHD and what ADHD is and the different symptoms and why it looks like their child may indeed have ADHD. And then there's a discussion about treatment options. And a treatment plan is put together.
So how do you help kids that have ADHD? Is there a best way to do it, or is it different with every child?
Well, the treatment definitely needs to be individualized. And some kids will respond very well to relatively simple treatment plans, and other kids will require more intensive treatment plans. I think there are 3 different types of treatment that we'll usually think about. One is it's very necessary to work with the schools, and that's crucially important. That's if you make the most beautiful treatment plans in the world but don't work with the school, you're going to likely still have trouble.
Because the kids are spending so much of their time there and interacting too, right?
Another big chunk of the treatment plan has to do with counseling. And the counseling, some of it is directed towards the kids. And the kids are taught how to be better organized, how to finish tasks, how to handle frustration, how to handle social difficulties, if indeed their impatience and tendency to kind of blurt things and boss people around is getting in the way. Also, there's counseling with the parents, and the parents are given a lot of information about ADHD, and they're given some guidance regarding what would help make things better at home, how to help the kids finish homework, how to help the kids go to bed, get the right amount of sleep, that type of thing. And then the other treatment strategy is medication, which many people think if they bring their child in for an appointment, they're going to be forced to put their child on medication, and that is absolutely not true. If it looks like medication would be of help, we discuss that as an option, but then the parent certainly has the right to say yes or no, and sometimes they'll say, no, not at this point. Let's see how it goes with these other treatment approaches first, and then consider medications if need be. Other parents will say, good heavens, these problems are just overwhelming. Let's do everything we can.
Well, unfortunately, that's all the time we have. I know it is a very wide-ranging topic, and there's much more to talk about, but we'd like to thank our guest, Dr. Janis Strickler. She is a board-certified psychiatrist at Fairmont Medical Center. Thanks for joining us and talking about ADHD straight up.
Thank you very much.
And you have a great day, and be healthy.